Hi everyone, thank you so much for making it here to my YouTube channel. Hi everyone. Hi everyone. Hi everyone. My name is Nana Bajubi and welcome to my YouTube channel. So for those of you that might have come here because I referred you to this video from TikTok, thank you so much for actually making it here. And for those of you that may have just chanced upon the video and decided to make it up until this minute, thank you as well. And thank you for anyone else who might see this video sometime later in the future and decide to click it for any reason that may be. Thank you so much in advance. I am a registered nurse in the UK, currently practicing as a public health nurse in England. Not long ago, I created a video on TikTok, which drew a lot of people's attention, and I got a lot of comments privately and in the comment section as well, asking me for some details regarding public health nursing. And so I thought it's better to create a detailed video here on YouTube, as I feel I'm a bit limited with doing that on TikTok. So this video is basically going to talk about public health nursing in the UK, what their roles are, the differences, just a few differences across the UK with regards to the roles of a public health nurse, how you can become a public health nurse, be it from overseas or for people that are already in the UK, and the prospects of becoming a public health nurse. What are the career progressions? What are the things you seek, you tend to benefit as a public health nurse? So if you are still here at this time, I would say stay tuned. I hope you enjoy this video. I hope it makes a difference in your life or your journey as a nurse in the UK. And yeah, so going straight to the point, I have some notes here that I'll be referring to, so excuse me if I look away from the camera. So public health nurses generally have a mandate to provide care in the community, and the main goal of public health nursing is literally to maintain health and well-being of the people in the community on a preventative level or preventive level. So what public health nurses do across the UK is to work with children, young people, and pregnant women sometimes. Their mandate is to promote health, prevent illness, and protect children through certain avenues, primarily health promotion. In the UK, however, safeguarding is a very important big aspect of public health nursing, at least in England. And public health nurses, whether specialized or at the band 5 level, work with children from 0 to 5 years and 5 to 19 years. So 0 to 5 years on a specialized level is the health visitors, and 5 to 19 on a specialized level is the school nurses. However, as a public health nurse at a band 5 level, you tend to either be working under a school nurse or a health visitor as a band 5 nurse. Sometimes, however, for instance, myself, in the trust that I currently work, I tend to work in both 5 to 19 and 0 to 5. So my role cuts across 0 to 19. When you specialize, however, you have to be either in 0 to 5 or in 5 to 19. So if you're watching this and you want to be a public health nurse, depending on the trust that you will be going to, you can ask and find out if your role is going to be public health nurse 0 to 19 or public health nurse 5 to 19 or public health nurse 0 to 5 years. Whatever the role will be, you will still be promoting well-being, preventing illness, and protecting children through early help, through health promotion and safeguarding. Now, in England, the role of a public health nurse differs a bit from other regions in the United Kingdom. In my trust, for instance, We don't do anything clinical, so we don't provide immunization or vaccinations to children or young people. In some other trusts, however, immunization is part of the role of the public health nurse. So you will probably be based in a clinic, or during your home visits, you will be providing immunizations to children in their homes. One region where this is where I know this happens is Northern Ireland. So I lived and worked in Northern Ireland, and during my time there, I tried to interview for the role of a public health nurse at the level of Band 5. And in my interview questions, I was asked to describe how I will manage the clinic on a typical day. That gave me the impression, of course, that at least for that trust, immunization was a part of, or is a part of, public health nursing. In my current role as a public health nurse in the trust that I'm currently working with in England, that is not the case. We don't do any immunization. Immunization is given to another team completely. So they have the AIMS team that deal with immunization. In Wales, school nurses deliver school-based immunization and health promotion programs. So these are some of the differences. So I just want you to put it in mind that my role currently might be slightly different from yours. If you just oppose this to the role of public health nurse in Ghana, what I came to notice is in Ghana, we did everything from immunization to health promotion to school nursing to home visiting. It all falls under your role as a public health nurse. Although sometimes you tend to be in the admin side of public health nurse where you work in the office. But in England or in the UK, some of these roles are decentralized or are given to other people to do, so you don't tend to do everything as a public health nurse. Safeguarding is one other very important part of public health nursing in the UK, no matter the region that you are, because UK generally is very big on safeguarding. So as a public health nurse, your role in safeguarding is being attentive and observant when you go for your home visit, or when you speak to a parent, or when you come into contact with a child. The lived experience of a child, the voice of the child, what is the child saying to you? What are you reading from the child's body language? What is the child actually telling you? When you go to the house, how is the environment like? Are the children dressed appropriately? Is there any sense of something not right? You are supposed to be the advocate of the child and even the parent as well, because sometimes the parents might be going through some difficult times where you need to advocate for them, get them the support they might need, especially if it's mental health, so that they can be better parents for the children. So you have to be very observant. You have to be abreast with safeguarding rules, safeguarding guidelines. You have to communicate often with your safeguarding lead in moments where you are a bit lost as to what exactly to do. There are people that are there to hold your hand, to direct you exactly what to do. So it's not it's not too much of a pressure. You have people to constantly be there to help you if you come across any safeguarding need. Sometimes you will attend safeguarding meetings, like when there's social care services involved, and the child and the parent of the child or the carers of the child have to meet with other professionals like the school, like police or whatever. You have to be in those meetings, and when you come back from those meetings, you have to write your own kind of report of what happened at the meeting, and you have to liaise a lot with other professionals from the multidisciplinary team. You have to be confident to be able to be in these situations or meetings, and you have to be non-judgmental. You have to make sound decisions, one that benefits both the child and the parents as much as possible without taking any sides. It can seem like a lot to deal with, but as you go on, as you get to do these things a bit more, it becomes less of a struggle. You tend to be more confident in doing it. And personally, I think that it makes you a better person. The exposure is amazing. The skills that you get is great. You can move from public health nursing and be anything later on. The health sector is so vast and it has so many angles and departments or sectors that you can transition to from being a public health nurse because of all the things that you're exposed to. You also provide education, provide safety advice, or provide advice in general. For example, safety advice to parents, to children. You help, you do one-to-one support or advice with the children in school, or you can go to their homes to do a one-to-one support with them. For public health nurses that work with 0 to 5 years, you do growth monitoring, where you go to the homes to check the weight of the child, the height of the child, the head circumference, give advice to parents who are probably new mothers, or give advice on breastfeeding, do a breastfeeding assessment, etc. So aside safeguarding, there's so many other things you do as a public health nurse with the clients themselves in their homes or in school, depending on the age of the child. However, safeguarding is although safeguarding is very important in your role as a public health nurse, it's only an aspect of your role as a public health nurse. In terms of career progression, your role as a public health nurse starts as a band 5. Then you can progress up to the point of 8A or possibly 8B. And that we all know is managerial in nature. From the point of band 5 public health nurse, before you get to that point in the first place, you should have been registered on the NMC Part 1 as a registered nurse, a registered midwife, or registered pediatric nurse, or a registered mental health nurse. In some trusts, you have to go through very rigorous interview, like presentation, answering some quite good amount of questions, and proving that you know a bit of what you are going into, and you have the experience to be able to take up that role, because this is a very autonomous role, which you do most of the time as a lone worker. Flexibility, hours and flexibility. So currently for me, I work on a 9 to 5 basis, but depending on your trust, you can get some flexibility to your hours. So you can ask to probably start off a bit early, 8 o'clock, and close maybe 6. Adjust your hours so that you do 4 days in a week instead of 5 days in a week. You can and then have a day off. You can also reduce the hours. Anything that works for you, you can do that. Personally, I work from Monday to Thursday. I am provided with a laptop, a mobile phone, and all that I can use to work without having to be in the office. So you have that flexibility always to work remotely. You do a lot of documentation, so you most of the time will need your laptop to be able to do those kind of documentation. That is why you're able to work remotely if you have to. After you take your specialist community public health nurse course and become a band 6, you can progress and interview for band 7 roles, band 8 roles, 8A or 8B. In terms of the skills that you need to be very good in communication. You need IT skills. It doesn't have to be perfect. You always can improve on the job. You need organizational skills. You need to be very aware of the area that you are, the services that are available to parents, mothers, children, the referral point, how to refer. There's a lot of knowledge that need to be almost at your fingertips, but you get to be better at what you know the longer that you do you work as a public health nurse. Obviously, you can't know them before you start, but you get better at it. One skill that I think is so important that you need to have as a public health nurse is empathy, because most of the time you're working with people that are struggling with something, like for instance a new mother that is struggling with breastfeeding. You need to be able to put yourself in their shoes to be able to understand what they could probably be going through. Then you can offer them the help that's the best help possible. So empathy is a very important skill as a public health nurse. Being able to put yourself in their situation is one thing that will be invaluable for you as a public health nurse. You also need to be very aware of safeguarding. Safeguarding is a very important aspect of public health nursing, and you need to be aware. And the more you are aware, the more you see the need for safeguarding awareness. where to find the jobs. So you can go to Track. You can find the jobs on Track, Indeed, jobs.nhs.uk, or NHS Jobs. Basically, if even your trust might have the roles that come up on your feed every time you open your emails, you might come across that. In Northern Ireland, if you search on the HSC website, you will find a lot of these roles. There are some there are certain times of the year that some trusts will open the availability for you to apply as a SCIFN student, the trainee specialist public health nurse opening. It depends on the time of the year. It depends on the trust. So you have to know this and target it so that when it opens up, you just apply and you can ace the interview and get in. Some NHS trusts have interview trainings. HSC-NI has interview trainings that you can book on, and they will literally teach you how to ace your interview. I did that and it was great for me. It helped me a lot, and I'm sure it can be handy for you as well. You can also ask for feedback. For every interview you go, ask for feedback. One of the feedbacks that I got from my interview actually helped me to be aware of the interview trainings that HSC-NI provides and helped me to get onto it, and it did magic for me, honestly. So be aware of these things. Equip yourself with knowledge, better yourself. Even if you don't get the job, guess what? You have become a better version of yourself, and next time you have the opportunity, it's going to come in handy for you. So yeah, this is all that I have for you. I think I probably may have done quite a good job in getting you all the details. However, if there's anything that you didn't understand, if there's any questions that have popped up, if there's any further discussions that you would like me to go into a bit more, I am so open to it. I welcome all of this, and I will do my best to meet you at your point of need in terms of what public health nursing is all about as best as I can. I'll also encourage you to do some research for yourself and equip yourself with knowledge. Thank you very much for staying up until this point. Leave me all the questions you have, like I said, and I'll do my best to tackle them one after the other. Thank you, and please share this video, comments, and see you later in my next video. Thank you. Bye.